I'll be giving you a talk on apparently what you've all been waiting for. And I did this work under the mentorship of Dr. Kirby. Okay. So the only financial disclosures that I could give were my student loans, but that would just depress everybody, so I left those out. So, in hidradenitis, even though it's primarily an inflammatory condition and we're still unsure about the bacteria, and I won't get into that, antibiotics are used in the treatment. When using antibiotics, we have to consider the long-term consequences. And there was a study published just this year by Fisher et al., where they examined the patterns of antimicrobial resistance in lesions of hidradenitis. And this study found that patients using antibiotics for HS were more likely to grow bacteria in their HS lesions that were resistant to the antibiotics that they were on. Not a surprise. And we also considered a systematic review by Walsh et al. On antibiotic resistance in acne. And that article summarized that the data that indicates using a benzoyl peroxide wash in combination with oral or topical antibiotics for acne can reduce the antibiotic resistance in those lesions. So we knew that there was a problem in HS with increasing antimicrobial resistance in bacteria. And we wanted to see if this method of using antimicrobial washes while on antibiotics would have a similar benefit in HS as it does in acne, even though they're two different disease processes. So to do this, we collected data from our EMR at Penn State Health. We queried for all patients from 2005 to 2017. The patients were identified with ICD-9 and 10 codes for HS, and then the diagnosis was confirmed in a chart review. We gathered the data on the antibiotics that the patients were on within a month prior to having a tissue culture or wound culture. We looked for both chlorhexidine cleansers and benzoyl peroxide cleansers if they were used in the chart and documented in the chart. And we also collected data on what species of bacteria were grown and the susceptibility profiles of those bacteria. So we were only able to include 25 patients who had a total of 32 cultures from their HS lesions. Our subjects in the study had a mean age of 35 and a half, and 72% of them were female, which fits with the epidemiology of HS. And the most common sites of culture were from the axilla and the thigh. For the cultures that we were able to analyze, 15 people were not on any antibiotics or a cleanser. 12 people were on an antibiotic without a cleanser, and 5 people were on an antibiotic with a cleanser. And of those 5 people, they were all using chlorhexidine cleansers. So I'm sorry for the benzoyl peroxide guy out there. Our data today is only for chlorhexidine washes. So then, looking at the bacteria species that we grew in the cultures, I think the interesting points would be, kind of talked about this earlier in the day, but most of the species that we grew were some sort of staph, with almost half being Staph aureus species. Here we have the rates of resistance from the bacteria, and first I'd like to point out the rates of resistance for all the cultures from all the subjects, and note that there were high rates of resistance to penicillins. They're tabled in decreasing order of resistance. So up here, penicillins had the highest rates, and the macrolides, clindamycin, cephalosporins, tetracyclines, fluoroquinolones all had pretty high rates of resistance, and these are all antibiotics commonly used to treat HS. I would also like to point out that none of the bacteria were resistant to daptomycin, carbapenems, linezolid, rifampin, sulfamethoxazole, and vancomycin. Now, if we break down all the samples into the samples where we include the patients who were on an oral or topical antibiotic while using a concomitant chlorhexidine cleanser, and those without using a concomitant chlorhexidine cleanser, we have these results. And I think it's worth noting that the patients using a chlorhexidine cleanser had about a 20% reduction in the rates of resistance to cephalosporins, macrolides, and clindamycin, and they had a smaller magnitude decrease in resistance rates to fluoroquinolones, aminoglycosides, and daptomycin. And then there were similar rates of resistance with penicillins and tetracyclines between the two groups. But unfortunately, none of these differences were statistically significant. So our data did show that these patients using a chlorhexidine cleanser had lower rates of antibiotic resistance. But with only 25 subjects with 32 cultures, our findings couldn't establish statistical significance between the groups. It's also worth noting that only 5 of the cultures that we had were from patients who were using a concomitant chlorhexidine cleanser. And this might reflect that there isn't a standard recommendation for the use of chlorhexidine washes or benzoyl peroxide washes, or it could be reflective of the fact that they're over-the-counter washes and they're not quite, maybe Penn State, we don't do a good enough job documenting them, or maybe just we as a whole don't do a good enough job documenting them. And finally, we just need a bigger sample size to better evaluate whether using a concomitant chlorhexidine wash can effectively reduce antibiotic resistance in acne, and we are more than happy to collaborate with any of you if you're interested in this. Thank you. And if you have any questions, I guess I'll get them after.
Thank you, Paul.